Hi, I'm John Carlson. I'd like to welcome you to the APA Psychotherapy Series. This series is on psychotherapy over time, and this program is on existential therapy over time. Our guest expert is Dr. Kirk Schneider. Welcome, Kirk.
Thanks. Thanks very much, John.
Just what is existential therapy? It's more of a philosophy.
Well, existential therapy is a philosophy. It has very deep roots in a philosophical tradition going back to Kierkegaard. But really today, John, it's very much applied, and many of us are making it more and more practical.
Can you talk about what makes this a distinctive approach?
Yes, existential therapy is really about the question of how am I going to live in this moment between you and me and within myself. And more importantly, how am I willing to live at this very rare moment of time where I can concertedly sit with a very attuned witness who will help me to discover much more deeply about how I'm willing to live my life. And that implicit question really runs through the entire process. People can look for that.
So what are the aspects of therapy that you use in this approach to help people live?
Well, I can lay that out if I tell you a little more about the philosophy or the approach, because it's really about how am I willing to live in this moment in the face of great loss, of death, of anxiety. And there are a variety of ways of approaching that question and a variety of levels within this existential integrative approach. It could be approached physiologically, even medically, cognitive behaviorally, psychodynamically, interpersonally, and ultimately at what we call the being level, or the level of immediacy, affect, and kinesthesia, or embodiment. So what we try to do in this approach is to make ourselves available for this deeper being level integration of whatever one is struggling with. But we can work with them at a variety of other therapeutic modes.
So it's a holistic approach?
It's very much holistic and depth.
And it's also an integrative approach, because you put out a lot of different approaches, like CBT and...
All of those can work within this overarching existential or experiential context. The experiential is the soup. It's the context within which the other healing can happen more intensively.
Are there strategies or techniques that would be unique to this approach? Yes.
We focus on 4 dimensions. The first is presence. Presence is a holding and illuminating of that which is charged and alive between me and the client and within the client. And that takes place throughout the therapy. That sort of, again, context or soup. As we move closer to an experiential level of work in this approach, we then invite the client more into the struggle that they're having. We help them to become more present. So it's not just the therapist's presence, but we have ways of calling attention to how the client is holding him or herself. What is happening in the client's body, with the client's feelings at the time that they're struggling with the issue. So it's not just talking about the issue, but it's embodying.
So presence for both the client and the therapist, or setting that context.
Yes, that's invoking the actual, or inviting the client into deeper presence. Then the question comes up of, well, what do you do when a client resists or protects himself from going deeper, because it's obviously very painful, very difficult. So then we work with the resistances or protections, and we in some sense, are holding a mirror up to the client and helping them again to ask that question, how am I willing to live in this moment? Am I willing to really confront this struggle at the deeper embodied level, or am I going to just circle around it or find ways of diverting myself? And that builds a frustration eventually. Often, very often, it builds a frustration to the point where, as the client keeps seeing how he stops himself from going deeper into the issue, that he or she is not going to take it anymore.